Hi, this is Jessica DeMassa in the Guidewell Insights Lounge here at Singularity University's Exponential Medicine. I'm joined now by Dr. Anthony Bossis. He is the Clinical Assistant Professor in the Department of Psychiatry at NYU School of Medicine. Welcome, Dr. Bossis.
Thank
it's a pleasure
you so much.
to have you.
Good to be here.
So tell us a little bit about the work that you do right now.
Sure. So we're doing research looking at a very novel way to help people address and mitigate anxiety and distress that accompanies them at the end of life. These are people who have cancer and who have end-of-life distress, existential, psychosocial distress. A large part of palliative care is looking at the emotional component of how we die. We don't die well in America. We've gotten better at chemotherapies, we've got better at pain control, but we're not quite where we should be at addressing the emotional component, the emotional, existential, psychological piece of dying. I'm very fortunate to be involved with some other scientists at NYU looking at the results in the study. The study involves a novel compound called psilocybin, which is the hallucinogenic compound in a certain species of mushrooms. This is FDA-approved clinical trials. These medicines aren't available outside of clinical research now, these phase 2 trials. And the research is organized around a psilocybin dose, one dose, and the psychotherapeutic period around that dose. They have this incredible we call mystical experience or spiritual awakening that profoundly has the potential to mitigate, to reduce end-of-life anxiety, distress, and really help cultivate meaning in the way these are meaning-making experiences. And they're not drug studies in a typical sense. Most drug studies, as long as you take your blood pressure, medicine, your blood pressure is down. Take your Prozac every day, you treat your depression. This is taken once, but it's the experience, the transformative, very powerful experience, potentially, if it happens, that relieves and mitigates that end-of-life distress.
What kind of feedback are you getting from the patients that you're working with on this?
It's been stunning. It's been incredible. We just completed this study, and the results are just, it's changed my life, hearing their stories and watching them. We have people who are approaching the end of life or have cancer and are afraid of dying, and they're reporting experiences of profound love that is the important thing in life, or profound meaning in the sense that they accept the end of life, even though it sounds impossible to do that.
Right.
You can do that. It recalibrated what's important, recalibrating, reframing love for their family, for themselves, experiencing a very spiritual state of consciousness. It's quite stunning as a scientist to watch people speak about love in this way. But that's what the data is showing us, and it's quite profound. And we're seeing reductions in, of course, their distress and their suffering.
So talk to me, I'm going to jump on something you said earlier. You said we don't die well here in America.
Right.
So talk to me a little bit more about that.
We don't die well. Yeah, so the discipline of palliative care is about treating people of a life-threatening diagnosis. Anywhere along that trajectory. So if you're diagnosed with a cancer, palliative care is providing, ideally, spiritual, psychological, medical, pain-oriented approaches. But we have a paucity of approaches that help us cultivate meaning when we're facing such distress. So we've gotten better. The last 15 years, palliative care has made incredible advances in drawing attention to and providing therapies to help promote meaning at the end of life.
Right.
We have a long way to go. So this research, these clinical trials that are occurring at NYU, UCLA, and at Johns Hopkins are promising that people are having these incredible experiences, these internal experiences that promote and change so much of how they're living and dying.
So what do you think needs to be done to really pay more attention to the mental health aspect of palliative care?
A lot. I mean, education, first of all. It is happening. There has been changes in the past 10 years that are helpful. But increased education. And also increased conversation in the culture, not just within mental health, but across the culture. We don't speak about death. We don't speak about dying. It's kind of a taboo topic, and we're all going to die. And so, increased acceptance of it as a topic, to talk about it, not to medicalize it, where you put it behind closed doors and put people in an ICU for the end of their life. There's a phrase in palliative care called a good death. It sounds funny. It's a strange combination of words, but a good death is defined as a death, with relief of suffering. When I ask people how you want to die, they say things like, at home, in my bed, people who love me, family, not in an ICU with 1,000, surrounded by medical equipment.
Right.
So it needs public education, of course, additional training in medicine and medical schools, and ideally novel therapies like this, hopefully continued research to follow the safety of these. Are they safe? Are they effective? And these promising therapies.
So what has you most optimistic about the future of not only palliative care, but I guess healthcare more broadly?
Yeah, well, palliative care, I'm really excited about the changes that are happening.
Sure.
And the increased education. In healthcare, I'm excited about the potential. We have ways to go with the connecting all the various disciplines. We're very separate. So psychiatry, neurology, oncology, cardiac, and this conference speaks about that, the interconnectedness of all the disciplines to provide a comprehensive whole look at the body versus separate disciplines. So little bit, I think we're getting there.
Good. Well, Dr. Bossis, thank you so much for joining us.
Great.
The research that you're doing is truly inspiring, and I think definitely paying more attention to how we are dying in this country is of prominent importance here. So thank you for joining us.
Good to be here.
Thank you to be in the GuideWell Insights Lounge. I'm Jessica DeMassa, reporting from xMed in the GuideWell Insights Lounge. Thank you for joining us.